So Geoff Rubin is going to continue in this area with communication skills for the radiology resident.
Thank you, Dr. Nager. What an awesome talk, huh? You guys should be wide awake after that. Super. Awesome to be speaking to you all, radiology residents. So glad that you're here at the Society of Thoracic Radiology. And over the course of the next 15 minutes, I'm going to talk about communication and hopefully communicate this effectively. It's an important topic. It's something we do all day long. We communicate everywhere. We communicate in the reading rooms, when we're having a readout session with our attending physician, when we're consulting on those opportunities when the referring physicians come in and ask us about their case. Just out of curiosity, by show of hands, how many of you see clinicians coming into your reading room these days? Excellent. Good. Glad we haven't lost that one. And then in between, when you're just sort of in the room, working, maybe one of your fellow residents is in there, maybe an attending's reading out, communication's happening all the time. And then at conference, either we're presenting or we're in the audience. And so, what are you communicating? Are you the guy who's jumping up to answer the question as soon as the attending says, what's going on in this case? Or do you have your phone out and are you clicking on it? And I can assure you that whichever person you are, the person who's presenting is noticing that and you're communicating something to them. And then there's all the public spaces in the hospital when you're walking down the hallway. Do you greet your fellow department colleagues? Do you greet the surgeon that you saw in tumor board? Do you try to say hello to everybody, or do you have your head down? Again, communication is fundamental. And so I'm going to break this down into 5 types of communication. We're going to talk about verbal communication, which is going to be our primary topic. We're going to talk about nonverbal, written, visual, and then listening as a mode of communication. When performing verbal communication, when you are speaking, it is really important to know your audience and respect your audience. And I'm going to tailor the conversation a little bit toward presenting. And presentations happen in many, many dimensions. They can be formal presentations, such as me standing here speaking to you today, or they can be off the cuff, such as when the consultants come in, they want you to show them their case, and you're going to discuss that. How you speak to your audience should be very much a reflection of who you understand that audience to be. If you are in a community group on the weekend explaining the value of radiology to a bunch of lay people, you're going to speak to them differently compared to a room full of pulmonologists and ID specialists or compared to a room full of radiologists. Language matters, and it's important to plan before you speak, organize your thoughts, and use the right words when you are communicating what you want to say. Finish your sentences. Oftentimes people start speaking and then it kind of trails. And you don't exactly know when they are finished speaking. It is important to bring confidence into your voice and to make sure that you carry your sentences through. A particularly important application for communication, particularly as residents, is presenting a radiology case. And I would surmise that everybody here has been educated on approaches to present a case. But just in case you haven't, or you want to hear a different approach, I want to talk about that because it's so fundamental. The way that we as radiologists are perceived within the hospital, the value that is identified with us as we speak to our referring physicians, even when a hospital administrator happens to come up and ask for information on something, the way we explain it, the way we communicate these things is very important to our standing in the hospital and the respect that we have for the information that we're going to share. So when you begin to describe a case, it's important to be organized. And as I mentioned on the prior slide, take a moment. You don't have to start making words right away. Look at the case, observe it, and when you're ready, you start to speak. Ideally, with effective and efficient information. This is a schematic of how I would love to hear the case presented, starting out with what types of images are presented. I am presented with a PA and lateral radiograph. How were they acquired? In the upright position. What do I know about the patient? In a 65-year-old female who presents with cough. What are the salient findings? You go on and describe the findings in the image. What is the differential diagnosis? Summarize to narrow and order the differential diagnosis based upon what you believe is most likely from the information you have available, and then articulate any next steps. Rinse and repeat. This is a workflow that you will participate in, that you will present many, many times over, and it should become automated. But it's remarkable to me how frequently when I ask someone to discuss a case, when I ask a resident to discuss a case, how they don't necessarily have this organized thought process in their mind. And I can tell you that it's very meaningful to somebody who understands the case and knows the details that they want to hear from you when you use an organized approach such as this. And it shows that you're really paying attention and have a systematic and organized approach. A topic that is worth touching upon, at least briefly, when speaking about verbal communication are elements of speech that are called verbal fillers or disfluencies. These are utterances. Basically, utterances that come out that actually are just a part of human nature. In fact, it has been studied with fMRI that during the production of these disfluencies, that the brain is actively processing information. The problem is that it has also been studied that for those who have a high prevalence of these utterances, they tend not to get listened to effectively, and they tend to tune, your audience will tend to tune out. So, what do? If you suspect that you're somebody who has a number of disfluencies, or if someone tells you that you do, or maybe you don't know and you just want to find out, ask somebody to listen to you give a presentation and ask them for that immediate feedback. Or record yourself speaking and listen back. Could be a little bit painful, but well worth the effort. One strategy that has been described is if you have someone listening to you, have them have a jar with a bunch of pennies or coins, and whenever a disfluency comes out, they drop a coin in the jar. And you hear that clink, and it gives you an immediate feedback that you've just done it. And then at the end of the presentation, you can look in the jar and see how many coins are there and have a sense. There's lots of strategies. You can look on the internet at a number of different approaches. But the bottom line is that you are going to be performing verbal communication in a formal setting for the rest of your career. And it might as well get this stuff tuned up right now. And so these tips are ones that you can seize on and make the change if you have an overabundance of verbal disfluencies. Let's move off of verbal communication and touch upon nonverbal communication. I can't emphasize enough that we communicate a lot through our bodies, through the contact that we make with our eyes, the facial expression that we have when we're speaking, our posture and body movement, whether we gesture, and the nature of our verbal tone. And so important to be mindful of how we are projecting ourselves. If we're standing and mumbling and just looking down and, not making that connection, then again, people will struggle to listen. Written communication is a huge topic and one that I will not endeavor to unpack, but only from one perspective. And that is that when we use written communication, there are a number of different channels with which we write and communicate. We send text messages, we send emails, we might write a letter, or we might compose a manuscript for publication in a peer-reviewed journal. The way we approach the writing of each one of these communications should be totally different. And again, very much related to the audience that is receiving the message. Even if we take the topic of text messaging and ask the question, how do we compose our text messages to communicate? It's important to think about, who are we communicating with? Are we sending a quick note to one of our fellow residents to communicate something that's just very informally and touch-based? There might be a lot of abbreviations, there may be a few emojis. Who knows what you might throw in there to make it colorful. But if we're texting someone we don't know, maybe we're texting the attending physician to come to do readout, think about how you're going to compose those text messages, and you might want to tune them a bit to those who are going to receive them. Same thing with email, same thing with writing formal letter and manuscript. Be mindful of the approach that you take in preparing these written communications. As radiologists, we're in the business of visual communication. The imaging studies that we interpret are a reflection of a visual presentation, and so the clarity of that visual presentation is fundamental. If images are ambiguous, if people stare at them and their first thought is what am I looking at, then that is a distracting element. And so if we seek to communicate when presenting cases, for example, and we're going to sub-select certain images to present, then it's important to be mindful of, do these images give the information as succinctly and clearly as possible? In these first two examples, I can't even tell you what's going on in them, but they make you stare at them for a while and wonder. In this last example, this is a plot of some data. It looks really cool, but I couldn't tell you what it means or what's associated with it. My advice is to really keep it simple, silly. And when you use the KISS method, take advantage of the tools that you have available. And forgive me for heading below the diaphragm during the thoracic imaging conference, but on your left is a single cross-sectional transverse section from a CT scan showing a transplant kidney in a patient where there are 2 renal arteries. On your right is the exact same case rendered with volume rendering, where it is very straightforward to see the patency of the 2 renal arteries as they are anastomosed to the common iliac artery, as well as the single renal vein anastomosed to the external iliac vein. And the image on the left, on the right, is really all you need in order to convey to the referring clinicians. The image on the left takes a little bit more explanation. And so, again, think about, as you prepare your images for presentation, that they are as clear as possible. Final thing I want to mention is that we actually communicate when we listen. And chances are, as residents or in our careers, we're going to be doing just as much listening as we are speaking, maybe even more. And so I want to just talk to you a little bit about the principle of active listening. Active listening tells the person who is speaking to you that you're paying attention and that you care about what they're saying. It's a matter of showing that you're paying attention. You look at the speaker directly, you put aside distracting thoughts, and you show body language that indicates that you truly are listening. Provide feedback. As they speak, it's fine to say, oh, yeah, that makes sense, or I get it, or that's interesting, or ooh, sorry to hear that. These are ways to show that you're listening actively, and sometimes you may even want to repeat back a little bit about what they've said. Let me make sure I'm getting this straight. Dr. Green actually came down and asked you to do that lupogram at 3 o'clock in the morning in a patient with a systolic blood pressure of 20? Whatever it is, showing that you are listening actively is a form of communication. And so let me just sort of bring this conversation to a conclusion and say that communication is something that we've been doing all our lives. And so, why should we learn to do it any differently at this stage? It's gotten us, the way we do it has gotten us this far. But like so many things in training, there are opportunities for optimization. And the first step is just being mindful of the process of communication and asking yourself, how am I doing? You could also ask a colleague, how am I doing? And depending on that feedback, whether it's coming from you or from your colleague, seize on that information and use it as a means to get better. It will help you through the rest of your career. I thank you kindly for your attention.